Hello everyone, I am Dr. Ana Vieira, and before we start this presentation, I'd like to thank the organizer and the scientific committee for inviting me to be part of it. It's such an honor to be here surrounded by so many brilliant minds of point of care ultrasonography. I was given the mission to introduce you to the topic, teaching the nephrologist to be a sonologist, how we save system resources by extending individual capacity. This title describes the work that our Brazilian POCUS group has been doing for about 10 years, training nephrologists to become much more than just kidney disease specialists, but to also become extremely more resolute doctors through insonation, reducing the barriers of the health system imposed by resources constraints in developed countries. This presentation will be divided into 3 parts. First, why to teach any specialist, not only nephrologists, to insonate the patient. 2, what to teach. And 3, how to do it. The use of POCUS is able to enhance the skill of being resolute of the nephrologist. Let's take a closer look in these real cases. Case 1. A few weeks ago, I was assisting a dialytic patient who arrived in our unit for his dialysis session complaining of dyspnea started the night before. His oxygen saturation was below 90%. In this context, the nephrologist who does not use POCUS would possibly diagnose hypervolemia and refer the patient for dialysis and fluid removal together with the other patients. But we do use POCUS, of course. So, a cardiac study showed a moderate left ventricular systolic dysfunction, but the inferior vena cava did not show signs compatible with hypervolemia. As you can see in these images, lung ultrasonography showed pleural irregularity, coalescent B-lines with spared areas and subpleural consolidations in a bilateral patch and a symmetric distribution. Lung ultrasound also showed regions with the presence of light beam, as we can see here, a finding highly suggestive of COVID-19 pneumonia in the context of the SARS-CoV-2 pandemic. It's important to emphasize that dialysis patients in a non-hospital dialysis clinic, as the one where I work, have no access to PCR or to CT imaging. This means that the use of POCUS is crucial to differentiate, in this case, the typical COVID-19 pneumonia from pulmonary congestion, allowing to isolate promptly the infected patient from other patients and from the staff, preventing the danger of contamination. In this another case, the patient was admitted to the hemodialysis clinic complaining of acute dyspnea, which started suddenly a few hours ago. A nephrologist without POCUS would be fated to diagnostic hypotheses based on traditional physical exam. Among the hypotheses to explain the acute dyspnea, pulmonary embolism would be considered, but in this case, the Wells score was low. The insonation of the right posterior pulmonary base of this patient showed an area of consolidation that, in face of acute dyspnea, made me consider the hypothesis of pulmonary embolism. The rest of the lung insonation showed a pattern. However, the assessment of femoral and popliteal veins was negative for thrombosis, as we can see here. Cardiac evaluation ruled out acute significant signs of cor pulmonale. We need to consider that we live in a city here in Brazil where the average time to perform contrasted CT is around 5 months for non-hospitalized patients as this one. Based on this information given by POCUS, we prescribed full anticoagulation. After 2 weeks of seeking for resources to fund angio-TC, the patient had a confirmed diagnosis of pulmonary embolism. In a nephrological disease ambulatory at a public health service, we treated an elderly patient with symptoms suggestive of renal colic. The insonation carried out by nephrologists ruled out a renal cause for the pain and oriented the diagnosis of abdominal aortic aneurysm. Again, you need to consider that an ambulatory patient would wait months for abdominal ultrasound in our city in Brazil. The physician using POCUS can do it within few minutes. Despite all the impact of POCUS in the hands of the specialist, especially in countries with limited health resources such as Brazil, the reality is that just a small portion of these professionals perform ultrasound in their medical routine. In 2020, we published the results of a survey carried out among 517 Brazilian nephrologists regarding the use of POCUS. 64% of them answered that they had no contact with ultrasound during their residence programs. Among those who did, the majority reported that POCUS PEER was used exclusively to perform invasive procedures. In addition, the majority of respondents, 95%, recognized the importance of POCUS and showed interest in being trained for that. What to teach to the specialist? The first studies that reported the use of ultrasonography in nephrology by a nephrologist were published by Dr. Charles O'Neill, still with the idea about the use of ultrasound to assess pathologies restricted to the urinary tract. We believe that the nephrologists or doctors of any specialty should be trained for multisystemic and integrated use of POCUS, using sonation as a fifth pillar of the physical examination, as reported by Dr. Eugene Brunwald. In our view, the idealization of a minimal training for specialists should be taught based on three main aspects. First, what are the most frequent pathologies that your patient has? In this sense, we developed a POCUS program for the nephrologists, recognizing that the kidney patients often die of cardiac causes, so it's important to recognize the main cardiac pathologies. It's also very common for these patients to present hypervolemia or other conditions that predispose to respiratory symptoms. For physicians who are in charge of critical patients, it's essential to recognize the principles of volemia, fluid responsiveness, fluid tolerance. The nephrologist must also know how to recognize vessels for vascular access and diagnosis of thrombosis, in addition to be trained for invasive procedures. The second question to be asked is, in what scenario do you assist your patient? ICU, emergency department, doctor's office, ward, etc. And lastly, what are the resource limitations your health system presents to you and which would be able to overcome by using POCUS? The result of a training based on these principles is the empowerment of the specialist using a tool capable of making it much more resolutive through integral and multi-organ insonation. In the face of a patient with dyspnea and progressive worsening of renal function, a traditional nephrologist would raise some hypotheses such as hypervolemia, secondary to chronic disease, or decompensated heart failure, for example. The insonation of this patient assisted in the office showed the important left ventricular cardiac dysfunction, in addition to tricuspid regurgitation and distension of inferior vena cava. By examining the lungs, we found a peripheral pulmonary consolidation in the posterior lobe, lower lobe of the lung. By examining deep veins of the legs, we also demonstrated a femoral vein thrombosis. All these findings together are compatible with pulmonary embolism as the cause of the patient's respiratory, cardiac, and nephrological decompensation. Why not training nephrologists or any other specialist to become more resolute and autonomous doctor? The first experience of our group in the creation of a training course for nephrologists took place back in 2012 at the WINFOCUS World Congress in Spain. 3 of the current members of our group, Dr. José Pazelli, creator and director of the course, together with Dr. Marcos Bastos and Dr. Anderson Rodrigues, they took part in that initiative. The training was carried out in 1.5 days based on the WINFOCUS USLS course. In 2012, we started training nephrologists in Brazil along these lines. In 2 days of course, doctors are exposed to intensive theoretical practical training. In our opinion, 4 main points should be prioritized when creating a curriculum like that. That the instructors are experienced in POCUS and practice it in the same specialty as the target audience, that there is reasonable time for practicing training, even if it is a short course, to have a few students as possible per instructor, improving quality of training and at the same time keeping cost effectiveness, and that ideally patients can be insonated in addition to health human models. In Brazil, there is still no formal certification of competence acquired in this type of training, but the practical results in the routine of trained nephrologists have made the main Brazilian nephrology societies, such as the Brazilian Society of Nephrology, giving us their endorsement and recognizing the importance of training. Here you can see all the topics covered in our course, and I'd like to highlight that the urinary tract is only a small part of it. Recently, the background of all these years teaching the course and the popularization of virtual meetings due to the pandemic motivated us to resize the program of the course. Currently, doctors have access to the theoretical content of the course through pre-recorded videos lessons sent 2 months before the course, allowing the students to calmly observe the content, being able to watch it as many times as they want before and after practical training. In a second stage of the course, a few days before the face-to-face meeting, an online meeting is held to consolidate the main points covered in each video lesson. In this new format, we prioritize practical activities with a reduced numbers of students per instructor. To those colleagues interested in developing similar programs in their specialties, we strongly encourage making the insonation of patients feasible, which significantly enriches the student experience. In this new format, we also have the How to Do It session with the aim of sharing our experience and tips for obtaining a quality image, to create the opportunity to discuss real cases and to teach how to incorporate POCUS into their routine. Finally, and also very important, we carried out online tutoring about 30 days after the course, so the students have the opportunity to discuss their images acquired after the course. Well, to conclude, I'd like to remind you that POCUS turns a good doctor into an excellent doctor when it stops being an anatomical tool and becomes an essential part of a medical reasoning in search of an assertive answer. I'd like to thank my colleagues who composed, together with me, the U&S group. These professionals are such an inspiration and encouragement for me in all of these years of learning and teaching how to be a nephrosonologist. What a journey it has been. Once again, I'd like to thank the organizing committee of this Congress for the invitation, for which I feel extremely honored. Thank you all so much.